The
Middle.
yes, until the medial phalanx. For the innervation of the upper limb was done by the brachial plexus. The brachial plexus, there is a spinal cord, and this branch is a C5, C6, 7, C8, and T1. C5 and C6, that's the upper trunk, and C7, middle trunk, and C8 and T1, here's the inferior trunk. Okay? And after that, you can see the division. All the posterior branch make a posterior cord, and the superior trunk, the anterior branch of the superior trunk, anterior branch of the middle trunk, make a lateral cord, and just leaves the anterior branch of the inferior trunk make a medial cord. So the lateral cord, medial cord, and posterior cord. Between them, we have a artery. Okay, it's the auxiliary in this area. After that, here the medial cord continue here, and there's the ulnar nerve from the medial epicondyle, posterior medial epicondyle, come here, and you can see 1.5 part of the fingers, 1.5 innervated by the ulnar. Okay, that's the lateral cord, musculocutaneous, and that's the musculocutaneous, and this nerve is a median from the lateral cord and medial cord joined together, and here is the median. The median has some branches, is anterior interossous, here is passed from the tunnel carpal, and that's the common palmar digital and proper palmar digital. 3.5 lateral. Okay. This branches is from the posterior. This is a radial nerve. That's the radial nerve have a deep branch and superficial, goes to the posterior. And you can see here, that's the radial, that's superficial. 2.5 and 3.5, that's the both is correct. That's the skin of the fingers innervated by the radius. That's in a totally, I explain for you the origin and the branches of the brachial plexus. But in the models, this hand is belongs to the left hand. Okay, the left upper limb. This is the lateral side, medial side. This is the auxiliary artery, and this is a medial cord, cord and lateral cord, and you can see a M here. Okay, that's the M. Here is the medial leg is ulnar, median, and musculocutaneous. You can see M part here. Okay. The medial cord, lateral cord. Okay, that's musculocutaneous, median, and ulnar. Okay, here in this area you can see the nerve and artery goes to the posterior. Okay, come back to the posterior. This is triangular, this is quadrangular space. So this is auxiliary. Auxiliary along with the posterior circumflex humeral. So this nerve is auxiliary. And here I have told you this is the ulnar from the posterior of medial epicondyle. Continue. Here is the Guyan canal. And this branch is a deep branch of the ulnar. And in continue, common palmar digital and proper palmar digital. And finally, 1.5 medial of the skin innervated by the ulnar. So you can see the pathway of the ulnar here. The lateral leg of the M here is musculocutaneous. Musculocutaneous penetrate the coracobrachialis, okay? And here is that's the brachialis, and biceps remove this here, okay? This is musculocutaneous and innervated the muscle of coracobrachialis, brachialis, and biceps. And finally here, this branch, this is the biceps. This branch is lateral cutaneous nerve of forearm, for the skin of the forearm. So the musculocutaneous innervate this muscle, and finally the skin of the lateral cutaneous nerve of forearm. This branch is a lateral cutaneous nerve of forearm. Come back here. That's the ulnar nerve. It's the medial epicondyle. That's the head of the flexor carpi ulnaris. And this is a ulnar artery, ulnar nerve. Here is a ulnar branch of ulnar nerve. Goes to the posterior and 1.5 of skin, innervated by the dorsal. And here, this branch is a deep branches of ulnar, and you can see here, okay, deep branches of ulnar. And here, this is palmar branches of ulnar. The palmar branches innervate the palmar, and finally, in continue, you can see the common palmar digital goes to the 1.5 medial fingers. Okay. Here is the ulnar and median. Okay, I have told you the median is in a lateral side of the brachial artery, and near to the elbow, if change the direction and come to the medial surface of the artery. This branch is a anterior interosseous for the deep layer of the, that's a flexor pollicis longus, and half lateral of the FDP. Okay, this is anterior interosseous. That's the ulnar, goes to the median. Okay, sorry, that's the median. Anterior interosseous, median, goes to the tunnel carpal, and here the median is a common palmar digital and proper palmar digital. Innervate tenar, the muscle 2 lateral lumbrical, and 3.5 lateral of skin. The ulnar, deep branches, common, this is common palmar digital, 1.5 medial. Okay? Well, just leaves these branches. These branches is medial cutaneous nerve of forearm. That's separate from the medial cord of the brachial plexus. So this branch is the medial cutaneous nerve of forearm. It's a medial cutaneous nerve of forearm, ulnar nerve, lateral cutaneous nerve, that's a continuation of the musculocutaneous. Okay? In the posterior you can see the axillary nerve, and here is the radial nerve. The radial nerve, you can see here 2 branches. One branch is perforate the lateral head of the triceps. This is the lower lateral cutaneous nerve of arm. And this branch goes to the posterior of the forearm. This branch is the posterior cutaneous nerve of forearm. So, two branches in this model are for skin, are cutaneous. That's the lower lateral cutaneous nerve of forearm, and this one is the posterior cutaneous nerve of forearm. In the continuum of the radial, have two branches. This branch is a superficial branch, and deep branch perforate is between the two layers of the supinator. The deep branch, we say the deep branch of the radial is the posterior interosseous. Here goes to the posterior, and you can see here, and innervate all the posterior, all the extensor in the posterior compartment. And the superficial, you can see here, that's the brachioradialis, okay? The perforate and come to the superficial, and finally distribute in a 3.5 lateral of the hand. Okay. So this is radial, that's superficial branch, and this one is a deep branch. Median, this is medial cutaneous nerve of forearm, this is ulnar. The median, this branch is the anterior interosseous. This is the common palmar digital of the median. This is the ulnar. This deep branches. This is the common palmar digital. And here is the dorsal branch of the ulnar, and here is the superficial branches of the radial. Okay. This branches of the median. Okay, that's tunnel carpal. And here is the ulnar nerve. The ulnar nerve 1.5 medial and 3.5 lateral, innervated by the median. If we remove the superficial layer, this is deep branches of the ulnar and innervate all the muscle here. Palmar arc here. Oh yes, this is the artery. In the dorsal surface, here is the superficial branches of the radial and dorsal branch of the ulnar.